Hello. Welcome to Have Your Say. Happy New Year to everyone. My name is Diana Robertson, co host on Have Your Say. My other co host is not here this morning, but we decided that because today was Martin Luther King's birthday, actually, birth date, that we would go ahead and proceed with starting our new year off in speaking as to how we can really honor his legacy. And so my guest this morning is Dr. Candace Robertson James. And she is a public health professional. I will let her give you her titles and explain a little bit as to who she is, and then we'll go on from there. Welcome, Candace.
Hi, thank you. Thank you so very much for having me today. My name is Candace Robertson James. My background is in public health. I am currently the director of the undergraduate and graduate public health programs at LaSalle University, and I'm also the chair of the Department of Urban Public Health and Nutrition there. And my background is in public health, as I mentioned, and particularly in community health. And so I'm delighted to join you today.
Thank you. So as we begin with a focus on who Dr. Martin Luther King was, he actually would have been 92 years old today. But in looking at what his legacy really was in regard to civil rights advocacy, there was a quote that he made that doesn't very often get quoted, but I thought it was very good as we think about health, public health, and the health of not only us as individuals, but the health of us as a nation. And so the quote is, of all the forms of inequality, injustice in health is the most shocking and inhuman. And so when we look at that, or, kind of ponder on that a little bit, as to what he was saying, and thinking about that, that's not something that he actually, when we hear different quotes, is not usually related to health. And yet, he certainly had an opinion on health. So as we begin to talk about how do we really honor his legacy? So every year we celebrate, everybody recognizes him every year, talking about the dream and realizing the dream. And more than 50 years later, after his assassination, we're still talking about how do we realize the dream. And so, what are some of your thoughts in general as to how we can really honor his legacy?
Well, it's so great. Obviously, it's timely thinking about Martin Luther King after 2020 and the year that we've had. For many people, it's been a wake-up call, right? It's been a wake-up call to perhaps realize we weren't as far along in the pursuit of that dream as some would have thought. Others were always quite aware that we weren't very far at all along in the pursuit of that dream. But I think for the nation as a whole, it has been a wake-up call. And many have framed and discussed 2020 as the year of many crises or many pandemics, not just speaking about, our COVID-19 pandemic, but the pandemic of racism that has essentially been birthed with the foundation of the country, and how we have struggled as a nation to really come to grips with that in an honest way. And so I think when we think about Martin Luther King, in light of the year, in light of the protest, in light of the book groups and readings and presentations and movies and, discussion groups and all that people have tried to do this past year to become more aware, I think that this really allows us the opportunity to make a commitment as we start 2021 to continue that pursuit of equality, to continue that pursuit of knowledge and understanding and awareness, where everyone can really push themselves to see the injustice, to see the racism, to see the discrimination that persists within our systems and in our nation that ultimately lead to that injustice that Dr. King spoke of so many years ago. And of course, that has been very visible throughout this COVID-19 pandemic, in that while there is a virus and the virus itself does not discriminate, of course, but we have different groups of people who have been differentially exposed to the virus because of lots of different social circumstances, and those who have had worse outcomes. And so we have to continue to reflect on the message that Dr. King was warning so many years ago, and hopefully continue to push forward in this pursuit, and not just have it as a day of celebration, but a day of really reflection, to really kind of see where we are and what do we need to be committing to in 2021, as we are still struggling with the virus, as we are not only the virus as a pandemic, but we're still struggling with all of the other pandemics that have been so institutionalized within our society.
Great. So as we talk a little bit more about the virus to start off with, so in a couple of months, the COVID-19 virus would have been ravaging for almost a year. Something like in our lifetimes, this is the first that we've experienced, okay? And many have contracted the disease and many have died. So what needs to be done in getting a hold on reversing the stronghold of this pandemic?
Well, you're right. We have, soon we will be able to acknowledge the 1 year anniversary, or that the year that we've come full circle for a year of dealing with COVID-19. And we have come a long way. We understand a lot more about the virus. We understand a lot more about how the virus is transmitted. And we even have a vaccine to really celebrate, that really allows us a huge tool in the toolbox of fighting COVID-19. So that is remarkable. Unfortunately, though, while we have come a long way with the virus, we have all acknowledged and recognized as a nation the steady increases from after the Thanksgiving holiday and from November into December, the increases in rates of COVID-19, the increases in hospitalizations of COVID-19, and the increases in deaths due to COVID-19. So the virus is still very, very serious. It still is troubling, and one of the problems with the COVID-19 virus is that for some people, they have absolutely no symptoms, and for others, they have, ultimately symptoms that could be fatal, or an experience that can be fatal. And so COVID-19 is still something that needs to be taken very, very seriously. And we need to all understand and appreciate the seriousness of this virus. And so while there's been many people talking about fatigue, right? COVID fatigue, fatigue of following all the things that we know we need to do. But the reality is we can't afford to be fatigued, because that fatigue can lead to increased rates, increased hospitalizations, and yes, even increased deaths. And so we can't allow that fatigue. Yes, we have been quarantining for almost a year now. Yes, we have been social distancing for almost a year. Yes, we've even been wearing masks, but that must continue in order to keep our communities safe. And so what I would encourage people is to do what we know and what we've been doing. We need to social distance. We need to minimize any sort of interactions with individuals outside of our household. We need to wear masks at all times. We need to wash our hands as frequently as possible. And if we are sick, if we have symptoms, we need to stay home and stay quarantine to make sure that we're not infecting those within our community. We need to understand that, yes, we are so tired and we are fatigued, and this has been a long haul. And this has not only come with the social restrictions, but it's come with so many other things. So many people who have lost jobs or had to take pay cuts or furloughs or had to experience their own losses within their families and friends. It's been a very difficult time for so many people. And it's hard to ask people to stay in this, to stay motivated to take all of these precautions. But it is really, truly necessary. And it's a commitment to one another. It's not a commitment to myself more than anything. It's a commitment to my family. It's a commitment to my community that as I follow these precautions, as you follow these precautions, that we're all able to be safe and ultimately be here for one another.
Okay. So many people of color are feeling, for various reasons, and some of them very legitimate reasons, that they do not want to take the vaccine. And so will this impact us greater for continuing to contract the disease? And what are your thoughts in regards to the pros and cons of taking the vaccine?
Yeah, so this has been a huge issue. While I mentioned that one of the huge breakthroughs, the huge tools that we now have to fight COVID-19 that we didn't have just even several months ago is the vaccine, the approval, now of 2 vaccines in the United States. And yes, we all can appreciate the nervousness of being amongst the first several thousand to take the vaccine. But I think it's important for people to know that you are amongst the first several thousands. These vaccines are tested amongst the thousands of individuals, and they have been approved because they have been studied and they have been found to be safe within the guidelines that we have set for every single vaccine in our country. And yes, when we think about vaccines, there are people who are hesitant to take lots of vaccines, but particularly this vaccine, because of, I think, many, many reasons. First, people may feel that unlike measles or mumps that we've had around for such a long time and have been studied, and we understand so much more about them. But and some people might feel like, well, this hasn't been studied for multiple decades. We don't know as much perhaps around the long-term effects of the vaccine. But I definitely want people to understand, again, the seriousness of COVID. And when we think about the benefits and risks of the vaccine and the benefits and risks of contracting the virus, right? And so you're not weighing the benefits of or the risk of the vaccine against the risk of being healthy. You're weighing the risk of the vaccine against the risk of a COVID-19 exposure. And we all know as the rates continue to increase, the likelihood of exposure also continues to increase. And so what I would say to people is that first and foremost, yes, it is perfectly understandable to be a little bit nervous or hesitant for taking the vaccine. Secondly, while you may feel that the vaccine process was rushed, it really was not, in the sense that it really did follow all of the different mechanisms that we have. There were no shortcuts as far as the science. The scientists take their jobs very, very seriously, and the approval boards and the approval processes and guidance that we have in the FDA was followed. This vaccine utilizes a new technology because it's an mRNA vaccine. And so that allows us to have a different experience, meaning that in many vaccines, you might be inoculated with a dormant or inactive or a form of the virus, but this does not act in that way. So you don't have to be afraid. You are not being injected with any dormant part of COVID-19. So you are not being infected with the virus at all. The vaccine will trigger the production of a protein that will kind of teach the body how to recognize and fight the COVID-19 virus if you are exposed to it. And so it's really just important to realize that the best best data and the best information that we have now shows that the vaccine is safe. And that also with that, you're right, we are still learning and we are still gathering data. And the CDC has put into place several systems to capture data. So we are capturing data on any adverse reactions. We are capturing data on anything that you may experience after taking the vaccine. And so you can download the app after you take the vaccine, and you can receive the updates, you can receive information, and you can be notified. And certainly you receive information regarding any adverse experiences that you may have. But at this point, many people have taken the vaccine, and it has shown to be safe and effective. We're still learning information. And I think one thing it is important, though, for people to understand is that it is a two-dose vaccine. And so you do need to take both doses in order to have the protection that we would want you to have. Yes, there have been some people who have experienced allergic reactions to the vaccine. And so particularly if you have had allergic reactions to other vaccines, that might be something you want to discuss with your healthcare provider. But in general, these things are the vaccine is going to be a really important part of us getting back to that normalcy that people want. Also, we are learning, and we don't know how long the vaccine will last. And it is suggested that even for people who have taken the vaccine, that you still wear your masks and still follow that preventative protocols that I outlined earlier. And so getting the vaccine is not necessarily that that green light to just take off the mask and do whatever you want to do. But it does mean that you will be protected from the complications that could arise from the COVID-19 virus.
Okay, very informative. And there also is now a mutated virus from the COVID.
So yes, we do have some. There have been notifications of different variants of the COVID-19. That is very common. Of course, viruses mutate all the time. But yes, we do have that right now. Right now, the current data suggests that the vaccine would be, effective against the variants as well. Of course, we'll continue to learn and continue to research and collect that data. But right now, the data that we have suggests that the vaccine would be effective against those variants as well.
Okay. So, Dr. Martin Luther King Jr. devoted his life to civil rights advocacy. Do you believe that his dream will ever be realized? And if so, what will it take?
That's a great question.
I know that's a big one.
Yes, that is a big question. Mm-hmm. I don't know if his full dream, we have to be hopeful, I think. And it's, of course, coming off of a year like 2020 and starting 2021, which will have very many similarities to the year we just left. It is hard for many people to have hope that things will ever change. So many people certainly have been fighting and advocating for things to change for so long. So I think on one hand, we have to have hope that things can and will change. Mm-hmm. On the other hand, I think that we have to have a serious reckoning within our country, and we have to really put some things out there that we really haven't done as a country, as a country yet. And there are other models, I think, that other countries have in certain ways, but I think that we haven't. And I think that we have to have a true and honest reckoning with our history, with our past, with the principles, with some of the principles that our nation was founded on, in order to really move us forward. I think, we're talking about vaccine hesitancy, and yes, there's like the normal sort of nervousness and fear, but there also have been communities that have been hurt and targeted and traumatized and abused by the scientific community. And again, we have to have that reckoning. And there are things that have happened 50 years ago, and then there's things that have happened 10 years ago, and there's things that are happening now where we have people who are taking advantage of communities of color, taking advantage of vulnerable populations across the world. And so we have to have a reckoning. We have to be honest with groups and with people to say, yes, this has happened. Yes, this is happening. And how can we prevent it? How can certain communities trust the scientific community where they have been abused? And then we pretend that that abuse hasn't happened. And so we have to be honest, and we have to be real, and we have to put in real systems, real safeguards, and open up our systems and processes so that people are able to understand and we're able to have more of a transparent process. But I think that starts with our honesty. Instead of just saying, you should get your vaccine, you have to get your vaccine. It's about protecting, our communities. It's about protecting yourself. I think we have to also go back and acknowledge the fears and why people have those fears and why people have that mistrust and why people don't want to be a part of anything that's coming from the medical community, and why, people are afraid, terribly afraid, so afraid that some people are willing to get the virus that could be fatal. That's a huge fear, but we haven't been willing to acknowledge those abuses, those traumas that have occurred and continue to occur. And so I think if we really want to honor Dr. King and we really want to celebrate him and celebrate his legacy, I think we have to start with honesty from the top on down, and honesty in a way, figuring out a way for our country to really come to grips with some of the foundations, with some of the principles that it was founded on, with some of the narratives that have been detrimental to communities throughout history and even currently, to think about the disparities that we have and the roots of those disparities, and to have real ways for us to have equal opportunities for groups within our society, for us to have experience the promise and the dream that Dr. Martin Luther King talked about. Really is for us to have a society where everyone has the opportunity to flourish and to be and do and become all that they dream of and all that they would aspire to.
Okay, that's a very good thought, and I'm just thinking in particular with our young people, because they're rising to have a voice in many things that are going on. But in addition to that, we know the systemic pieces that is what keeps perpetuating. It's like we feel that we take 4 steps forward and then 3 steps backwards, so every time we think we're making some type of progress, then something will happen to let us know, no, you're not there yet. And so I know some of my thought is that it really is a transformation of our thinking and thought process. And when you look at, Dr. King had a whole philosophy that he actually was part of who he was as a result of his studying of Gandhi and other folks as well. And even with him, there were people who clearly supported and believed in that dream, but then there were those who clearly opposed it, to the extent that he was assassinated for the person that he was. And in that fight, actually the night before, he was going to make a speech, talking about labor, talking about the unemployment, talking about all of these things that unfortunately we are still talking about. And in the plight of the pandemics, it's greater right now than ever, and so for the young people, how would you suggest that they continue to raise their voice in addition to the marches? How else do they need to raise their voice?
I think that, the marches have been a great opportunity for lots of people to raise awareness, and to keep the issues before people, before legislators, before Congress, before leaders, before city council, et cetera, whatever leadership you have, whether locally statewide, all the way up to the federal government, they are able to keep these issues present and prevalent in people's thoughts and minds. So I think the marches, continue to fuel energy, but I think also thinking about other mechanisms of advocacy. I think really thinking about solutions and thinking about policies that people can mobilize around to advocate for, whether they be local policies or, like I said, all the way up to the federal level policies. I think thinking about the organizations that they are a part of, whether they're schools, how do they demand change? How do they demand curricular reviews? How do they deal with grievances, and how do they deal with the disparities that are prevalent within their school systems, within food systems, within their local communities? And so I think really now we need to take those things to the next part and begin to kind of divide and conquer and begin to think about what are those systems? How can we specifically name some of the systems and think about the ways that we engage with those systems, and then how can we make change within those specific systems? And how can we get advocates to come alongside to really help in the cause?
Great. So as usual, our time is winding up, and I certainly appreciate this conversation today as our opening program for 2021. And just want to say that as I think you've given some really great advice as folks really consider the entire MLK weekend, that is not just the day, is not just this weekend, but if we really want to honor the legacy, that we look as to how we continue to move the advocacy throughout the year. And so I thank you and appreciate your thoughts and your input into this conversation. And thank you for the work that you do in regards to health and your meeting with folks and forums and all of those things to help keep us focused on the things that we need to be focused. And so as we move forward, just want to say to those, our audience listening and watching, that this is the beginning of 2021. It is very important that you think about, consider all of what is necessary in the process for you to have your say. Thank you.